We're live. Okay. Hello, everybody. Welcome to my show where apparently the host and the guest have to wear matching outfits. I'm Lucy Clyde, primary care doctor in Washington, D.C., whose thesis is that health is about more than just our cholesterol and our weight. It's about our everyday experiences, it's about access to information, and it's about having agency over our mental and physical health to the extent that's possible. I'm so happy today. I've got Susan Dominus here. Susan Dominus is an esteemed journalist from the New York Times. I've been following Susan's work for many, many years and was thrilled, for example, when she published a piece for the New York Times called Women Have Been Misled about Menopause. That was in 2021, I believe. And as I was just saying to her before we started, that piece helped me help my patients because it blew open the door for a more nuanced conversation about hormone replacement therapy, which wasn't to say everyone should be on HRT, hormone therapy, at menopause. It was to say everyone deserves a conversation about the pros, the cons, the risks, and the benefits. Now, Susan, she's done a lot of things. She's written a book in May about siblings. She's, a writer all the time, but she has written a new piece for the New York Times out 2 weeks ago about testosterone. Women, sex, testosterone supplementation. And one of the favorite things that I like to write about is how to counsel patients and listeners and readers about navigating this vast expanse of gray between the broken medical system and some of the gatekeeping over here and the wellness industry and some of the evangelism over here. So testosterone is a perfect topic for that space. And so, Susan, thank you so much for joining me and for writing this piece and coming on the show.
Thank you so much for having me. I love the interest that you're exploring. And I agree with you that testosterone is a really apt subject through which to see through that lens.
One of the most notable things about your article about menopause a couple years ago and about the menopause movement in general, the movement to deliver fact-based information to women who haven't had that kind of information at their fingertips, is this idea of quality of life being just as important as quantity. Obviously, my job as a doctor is to help people live longer. It's also, I think, to help people live better. And for a long time, women's health, women's sexual health, women's experience of pleasure has been shelved. We have talked about, how to make sure they reproduce and, reproductive health. And that's been a huge, huge advance, like birth control and, reproductive choice. But we haven't talked about sexual health for women in a very nuanced way or at all. So I'd love to hear from your perspective, Susan, what drew you to this topic and what did you learn about women's understanding about sexual health and sexual pleasure?
What drew me to the topic of testosterone specifically?
Yeah.
Well, I think the menopause article, I did write an article about menopause and hormone therapy. I think it was just 2 years ago, believe it or not. I think it was 2023, but
Maybe it was 2023. You know better than I.
Yeah, a lot has changed since then, but I guess, which is amazing because it's just not that long ago. But when I wrote that article, people in the UK were talking a lot about testosterone, but I wasn't really asking people in the US about it. When I did bring it up, the Menopause Society, for example, seemed a little bit dismissive of it or just didn't feel like there was enough research there. I just remember thinking oh, they're way out there in the UK. But then in the past 6 months or 8 months, it really started popping up on all of my streaming feeds, and I started hearing people talk about it, and friends were telling me they were trying it. And I realized it was, a huge phenomenon that I just hadn't been tapped into. And I got really curious about it because I think so many women don't even know they have testosterone in their system, and we so associate it with what the essence of being a man, So I was interested not just in the stories about, the kind of creams and gels that women get in fairly small doses, but I started hearing really out there stories about these really high doses of testosterone that some women are taking and, the experiences they're having, which are it's all just pretty fascinating.
It is. I think you're right. People don't realize that women make testosterone. I think, as you just said, people think it's a male testosterone. It's associated with chest beating and masculinity and muscles, and that is true, but what is also true is that women actually make more testosterone than they do estrogen. 25% of female testosterone production comes from ovaries, 25% from our adrenal glands, and then 25% from our peripheral tissues. And testosterone is actually part of our arsenal of hormones, and it does tend to go down at the age of 30. And it does play a big role in libido or desire, and also in metabolic health and muscle tone. What did you see in your reporting as the number one reason people were taking testosterone?
It's funny. It depends what they were taking it. It depends what dose they were taking it for. A lot of women. Okay, so as you probably know, and I think actually testosterone levels start dropping almost by age 20 until they're down to like 50% at a rate around age 60. And actually, while we're talking about it, it's just an interesting misconception that people think that it's a menopausal crash that happens. And actually, menopause coincides with like sort of the end depletion of a process that's been happening all along. But menopause doesn't cause your testosterone to crash. This isn't actually functionally useful for people to know, but I do think it is interesting for people to know, especially just because I think menopause has become such a rallying cry. But for what it's worth, testosterone depletion is not a function of menopause; it's just a function of age.
Right.
Which is why somebody in their like mid 40s or late 40s could really be feeling like the lack of it, long before they're actually even perimenopausal or mid 40s. Anyway, you have to tell me your question again,
So
Lucy.
my
What
question
we're
was,
talking.
what was the number one reason?
Oh
I mean,
yeah.
I'm sure there are a lot of reasons people ended up seeking out supplemental testosterone in your reporting.
Okay, so this is interesting. The best conducted, longest term randomized control trials for this like standard dose of testosterone, which is like 5 milligrams. That's what's been endorsed by the major medical societies in a 2009 consensus statement. For that amount, the only thing that the top researchers in the field will tell you it's been proven to help is libido. However, there are a lot of people who believe, based on anecdotal report or, some selected other studies, that it does help with energy or mood. Now, the people who conducted those really rigorous randomized controlled trials will tell you the placebo effect cannot be overestimated. Like it really is a major factor. But doctors I really respect say, I don't think that's what's happening. Anecdotally, I'm telling you, some women tell me that even this very standard dose of testosterone will make some women, not all women, but some women will have a response that they'll say they feel more like themselves. It's this third piece. They were on estrogen and progesterone, and then they went on testosterone, and now they feel more energetic, less tired. So some women do just go on for libido. A lot do. They just feel like I need some help. I still want to be sexually active. It's my husband's where my partner is really interested. But other women do go on it for things like mood, energy, cognition, even though the research there is not as solid.
Yeah, so I will say I too worship at the altar of evidence-based medicine, like the randomized controlled trial. We also can't ignore what our own eyes see. I've been practicing medicine for 25 years, and it is true that observational studies are flawed, right? An observational study could tell you that what's that? What like that? Observational studies run the risk of suggesting there's a causal relationship between, you know, phenomenon A and phenomenon B when they're actually just correlative. But it's hard to ignore the anecdotal evidence I see all the time in my patients who report an improvement in their libido after a couple of months on supplemental testosterone and an improvement in their sort of ability to maintain lean muscle mass. Now, those are also people who are focused on their well-being, who are focused on a high protein diet, who are focused on muscle strength, and placebo effect is alive and well. It's a wonderful thing, actually. I love placebo effect. Like, you're right. But I do think that just because those studies haven't been done doesn't mean that those things aren't necessarily true. I, as a physician, when I'm prescribing supplemental testosterone, I don't tell people that this is going to happen when I don't have evidence that it will. I will say we don't have the evidence that, but you may notice, you may also not notice that you're, have an easier time maintaining muscle mass, that your energy is better. But first thing first, the person who stands to benefit the most from testosterone, supplemental testosterone, is the person who has low testosterone and the symptoms that go with that low level. In
Yes.
other words,
Right.
just because you have fatigue or a low libido doesn't mean there's some other explanation for fatigue and low libido. Libido is informed by our relationship health, by our body image, by our mood, anxiety, and our ability to have 5 minutes to ourselves. Is informed by how much sleep we get, our, what medications we take. So, part of my job is to assess like what's the actual 360-degree situation going on and not assume that just because you're tired, you need testosterone. But I think you're right that it's hard to ignore, and it sounds like you're in your reporting, you saw people reporting on other effects that aren't necessarily proven in randomized controlled trials.
Yeah, although to be honest, because because I'm a reporter, I feel like I can't really deal in anecdotal evidence in a way. So I tended not to quote people who were taking the 5 milligrams on the subject of energy. I limited that stuff to their quotes about libido because I do believe in the placebo effect. And these randomized controlled trials, some of them did study things like mood and they didn't see a difference. So that suggests that and of course, something like putting a cream on every day, like it is going to have a strong placebo effect because there's so much going on, I think, with your association, with what you're doing. But it was the women who were on really high dose testosterone who really, it, it wasn't subtle for them. I mean, it was really overwhelming how much more energy they had and how much more focus they had and all kinds of effects that were kicking in.
What were the most noticeable in your reporting of people taking the higher doses? And I read your article. I just want you to share with other
Sure.
people. What were the? I mean, I was struck by what you wrote about the people who are taking supra-therapeutic doses of testosterone, perhaps because of the sort of more is more mentality. What did they say to you about the side effects that were unpleasant?
Well, the first thing I would say is I don't think a lot of women were taking super therapeutic doses because of the idea that more was more. I think that usually they were taking high doses because a friend of theirs was like, I went to this amazing wellness spa and they gave me a pellet and it injected it under my butt. And all of a sudden I was like crazy for sex and it was amazing. And so then they go to the same practitioner and they say, give me what, Jenny had. And it kind of goes from there. They're not even aware necessarily that there isn't that they're not really being, I don't think, thoroughly informed that this has not been studied, in great detail, and that there is an effect, but you might as well try it first before you go to this really high dose. So I think that the unpleasant effects that some of these women were feeling were, I've heard stories about, people experiencing rage, irritability, discomfort. There were some stories that didn't make it into the piece, because people didn't want to be, on the record, but just very, very erratic, being kind of like uncomfortably aroused, just feeling like it was almost uncomfortable, their level of arousal. But also maybe being so irritable with their husband that they didn't want to have sex anyway. So I think the problem, especially with things like the pellets, which is this little kind of grain of rice type capsule that people have inserted under their skin, is that it doesn't go away. Once it's in you, you have to, whatever your experience of that high dose testosterone is, it's with you for, several months. So
And that
that
is
could be a really long.
and that is a really outside the box way of treating people with testosterone. Like that is not something that I recommend or anyone who, I mean, it's people do take pellets and people take testosterone injections, but the standard of care, at least for women who are suffering from hypoactive sexual desire disorder or HSDD, is testosterone gel. Um, and so I want to go back to what you said earlier, Susan. I think it's a good point that sometimes I assume that it is the consumer, that is the patient who has the sort of more is more mentality. Like if one vitamin
Yeah,
D is good for you, then five is better. Now I see that all the time. Let me just tell you, I see people who have
sure.
like, I mean, who are taking more of something that they think is good. And so but I also think that comes from doctors and I think it comes from the wellness industry. I wanted to say, I think the wellness industry has done a lot of good in the sense of helping people understand that sleep and exercise and nutrition and is are good. It's just that it's not sufficient. So I think it's an important point, and I wonder what you would say about your understanding of the wellness industry and sort of people who are treating patients outside the sort of standard medical sort of frame.
I think that some of the doctors are also trying to do right by their patients. And so for example, some doctors I spoke to who were giving their patients levels of testosterone that would bring their testosterone to 3 or 4 times the level that a woman would ever, naturally experience in her own life. And I don't think they were and these women do report, like, at times they say, I feel great. Thank you so much. You've saved my marriage. Do I think that they're getting a really lengthy risk benefit analysis from that doctor? Is maybe they sign some paperwork saying, like, oh yes, in rare cases there's hair loss, but they're not really being briefed that, like, you stay on this long enough, like, chances are at a certain level you are going to lose a lot of hair and you are going to start growing facial hair. I don't think those hard conversations are being had, and I that's not my sense, at least. Nor are they even being told, like, this is not what the major medical societies endorse. You might want to start at a very low level first and see what happens. Now, so why are people going to the wellness spas and the aesthetic, centers and the longevity centers and getting these fixes? Because their own doctors aren't saying, I'm going to give you estrogen, I'm going to give you progesterone, or, like, let me take your testosterone levels. Oh, they look a little low. We have this thing. It's not, what the consensus statement of 2019 said is that this 5 milligram dose, the standard dose, has I think it was described as minimal but meaningful impact on women's sexual desire, basically. So maybe doctors aren't, like, rushing to prescribe it because it's not like a wonder drug, and it hasn't been studied for that long. So I think there may be, you tell me, but I can imagine a doctor thinking, this drug for women, it's really only been studied 2 years really, really well, maybe 6 years. We've got some, more encouraging research, but we don't really know what happens to women who've been on even standard dose, testosterone for 10 years. So,
Right.
and if and the impact is like, it's
Right.
it's meaningful,
Well,
but minimal.
I think it's an excellent point because on the one hand, I'm very critical, and I hope empathetic as well, for people who are in the wellness space as prescribers, and then people who are seeking wellness providers when their doctor gives them 5 minutes through no fault
Right.
of the doctor. Right, the system is so broken that people don't have time to talk about quality of life issues. There's an access problem. I mean, we could talk about that the entire time. So then, no surprise, people go to practitioners who are in the wellness space, who are, you know, perhaps more apt to prescribe things that are off label. At the same time, testosterone for women is not FDA approved for things in the US. So, like, it's just not FDA approved. So you have medical doctors who want to do the right thing, who are board certified, who are trained in, you know, internal medicine like I am, or an OBGYN, who, first of all, weren't given any training on hormonal replacement therapy. Like, I went to Harvard Medical School. I think I had 5 minutes of training on
Unreal.
menopause.
Yeah.
I mean,
Unbelievable.
I'm making that up. To me, it was 0, but maybe it was 5 minutes. I don't know. Um, and then, it took us a while to get comfortable even with hormone replacement therapy, like standard estrogen and progesterone. I was taught when the Women's Health Initiative, when the study was halted and the press conference, 2002 came out, like, we were told, whoa, 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 we got to back off on this HRT. So, like, it took a long time, as you well know from your reporting, and you have your eyes open as a female, I think, to allow doctors permissions to themselves to prescribe standard HRT. Now, again, testosterone is not HRT in the sense of, like, it doesn't drop around menopause. It drops because of age, starting in the 20s and 30s. But I think that when it's not FDA approved, testosterone, and we're still coming around to the idea of even just estrogen replacement, which is basically like putting glasses on when you can't see anymore. It's no surprise that women aren't getting this and the doctors are reluctant.
And it's also a controlled substance. So,
Yes.
So not every doctor has the certification. I don't even know what the correct term is, but not every doctor can, or nurse practitioner, let's say, can prescribe, or physician assistant can even prescribe it. But I mean, again, you tell me, but I gather that when you are prescribing a controlled substance, there's an extra layer even of bureaucracy that might just give you pause.
It just gives you pause. I mean, I think your license would allow you to prescribe a controlled substance, but, like, in my opinion, there shouldn't be as much of a, "Oh," like a pause when I'm prescribing testosterone like there is when I'm prescribing oxycodone to someone who has a substance abuse problem, but they had a knee replacement. Do you know what I mean? Like, and I think, I think we can agree. I'm imagining we agree, Susan, you tell me that, like, there's some gatekeeping in the medical space. It's not that we don't need doctors. It's not something we don't need. It's not that we don't need the FDA. There's also some, like, Wild West, sort of
Exactly.
cuckoo stuff going on in the wellness industry. And so the question isn't, should you consider testosterone? You should if you want to think about your health in a holistic way. It's just, let's understand the data. Let's talk about the lack of totality of evidence we have on certain elements that people claim testosterone works for. Let's talk about side effects. Let's talk about risk and benefit. And let's talk about the fact that your health isn't really defined by a level of testosterone. It's the context in which it exists.
Yeah. Yes. Although, as you said, if your testosterone levels look fine, it's probably not a great place to start, treating whatever is bothering you. But I wish I had thought to put it as neatly as you just did, which I think testosterone is the perfect example of, I guess you could call it a kind of treatment that doctors are uncomfortable prescribing in sort of mainstream reputable spaces because it's not FDA approved. And even though there's this consensus statement, like, how would I even do it? Dr. Rachel Rubin, whom I know is a friend of yours, told me that many doctors just don't even know how because it's prescribed for, it comes in packages that are sized for men. So it's very difficult to prescribe and give instructions, and people feel uncomfortable with it. And then I think because it's not coming up in doctors' offices, and yet women are hearing about it on social media, then when their Instagram feed gives them an ad for a longevity center that tells you that testosterone is going to give you back your oomph, you don't go to that center and say, but like, tell me everything I need to know about how long this has been researched and has it been endorsed by these medical, you don't even know what the standard of care is, or, who are the authorities. A lot of the doctors prescribing it, by the way, at these very high doses. I mean, you see nutritionists doing it, functional medicine, but a lot of OBGYNs are, opening their doors and doing this in certain kinds of, you know, um, midlife women career, midlife women health centers. And it's a real money maker, right? It's expensive. And I saw an ad, like a job search ad at some aesthetic center. I don't remember what it was, but I was on like Glassdoor looking for the way they were seeking people to join their clinics. And they were promising nurses who signed up to give testosterone shots that the nurse would get $100 in her pocket every time she gave somebody a testosterone shot. Well, then I've spoken to other women who told me that they went to go to one of these wellness centers. And before they left, they said, and don't be, on your way out, Susie will give you a testosterone shot. You're going to love it. And it's almost like de rigueur that you get that. So there's all this incentivizing and manipulating, and it's a real money-making industry, and women just don't know that there's other options they can try that are going to be less likely to have side effects.
That's right. And I think, again, we could talk all day long about the brokenness of the medical system, but I think what we're seeing is that people just want to feel well. They want to have a sense of agency over their health. And I don't know if it was the pandemic, but I just intuitively, I think the pandemic kind of highlighted for people this concept of, like, quality of life, right? Like,
Mm.
and I think, the internet obviously is full of information and people have access to information like never before about their health. But I think to the extent that the wellness industry is alive and well, it's a multi-billion-dollar industry born, in my opinion, out of the failures of the medical system to meet the moment and understand what health and well-being really is. It's not just about your, you know, hormone levels or it's about, having access to information. It's about having a trusted guide to make decisions. Should I take testosterone? Should I take HRT? Should I, do marriage counseling? Um, And I think that people are they want to feel well. And I don't think people feel well. I think we are in a moment in history, politically, culturally, and medically, where people feel very disenfranchised from their own bodies. They feel very disconnected from the medical establishment. Doctors are sort of like faceless, nameless, don't have time, not through no fault of doctors. I'm just going to say that right there. Like, it's not the doctor's fault. It's just the
Yeah.
system is so anti-doctor, anti-patient. And yet we still need doctors, right? We need doctors. We need a trusted partner to help us make decisions. But I think I don't blame people, for example, for going to wellness clinics and going to, and looking for the internet guru's advice. I just don't. I think people need to be careful who they listen to and be careful about what their incentives are. Like, if you're selling testosterone and you're recommending testosterone, if you're selling the like branded vitamins and you're like, and there's no evidence to back it up, and you're not credentialed in the thing you're recommending, I think that's there's a potential risk there. But I don't blame people for looking elsewhere out of the medical establishment. I mean, we're like, we're just catching up on HRT, right? And the FDA has a
Yeah.
black box warning on vaginal estrogen, which should be just, over the
Yeah.
counter. So
Yeah.
just a messy landscape. I'm just stating the obvious here.
No, but I definitely agree with you, and my heart really goes out to, I think the funny thing is, let's posit that the women you hear from and that I, did interview who were taking standard dose testosterone, and it did give them energy and it did make them feel more calm and it did restore them to themselves. If they've seen like 3 doctors before they can finally get to one who's willing to even prescribe standard dose testosterone, um, and then they get it and it really does make them feel better, as probably it does some number of women. Maybe, you never know if you're going to be the responder or not. You can see how that then disenfranchises them going forward from the medical system,
Right.
and they're going to go somewhere else where they're going to just be embraced for whatever it is that they want.
Yeah,
Yeah.
I mean, again, it's through no fault of doctors that we are often the people who shame people about their weight accidentally because we don't have time. We put people on a scale and say, "Oh, your BMI is high," as if A, the person didn't know, and B, as if we're giving them time to talk about what that even represents or what to do. Similarly, we don't have the time to talk about sexual health. We don't have time to talk about
Exactly.
maybe you
Yeah.
don't need testosterone. Maybe it would help to set some boundaries at work so you're not like a fried egg at work. Maybe you need some relationship counseling. Maybe you need an antidepressant. Maybe you need some iron. Maybe your thyroid's off. Like, just because we can doesn't mean we should. Just because you have a low normal testosterone level doesn't mean we should replace it. It means we should have the question in context. But, until we really reinvent medicine and have where every American has unfettered access to a home where you can talk about these things and it's affordable for people, I think the wellness industry is going to continue to do well. And I think people will probably take too many things they don't need and miss some things they do need that often are even lower tech than a
Yeah.
testosterone gel. But that's my
Well,
depressing
actually,
forecast.
I actually wanted to ask you something because, as a doctor, because a lot of times I did hear doctors say, testosterone's not my first line, right? Like, I'm gonna, maybe there's couples that first, okay, you want to eliminate pain. Let's start with vaginal estrogen cream. Like, let's get that out of the way.
Yeah.
But sometimes doctors would say, or maybe there's couple counseling, or maybe they need an SSRI. And I kind of always felt like, but why not just try the testosterone? Its safety for profile, at least for 2 years, is really good. SSRIs have really brutal side effects and they make some people grind their teeth. I interviewed, like, there's a lot of side effects. By the
I
way, they
love
lower
this.
women's. So why not just, and by the way, now you're going to make a couple go to couples therapy for like tons of money and it's time consuming, it's grueling. Why not just start with the testosterone, again, standard dose, see if it helps.
I love it.
Like, why
Well, you're saying
go there?
you're speaking my language. You're talking about dialectics. Two things can be true at once, right? Like, you
Right.
can do
Right.
you can have you can have a difficult marriage and have a low libido. You can you
Right.
good luck getting your spouse into couples therapy right? And good luck finding a therapist who can see you. Good luck affording couples counseling. So yes,
Huge. Yeah.
if the testosterone. So many of my patients report when they're taking, sort of low dose testosterone for their low libido, and they're already on HRT, and we ruled out all the other reasons why they could have low libido. That it's not that they all of a sudden want to have sex all the time. It's like the barrier to entry has been lowered. That's good.
Exactly.
That's good. I
Yes.
mean, if that's what they want, right? So my point is, yes, yes, you can do both. Like we can treat the biopsychosocial elements all at once of a patient's libido issue. Sometimes it's relational, sometimes it's sleep related, sometimes it's depression related, sometimes it's low testosterone, and sometimes it's worth trying all those things at once. Yes.
Yeah. It's funny. I just to give your listeners a sense of how I sensed after talking to women, they feel that the testosterone helps their libido.
Please.
It's women who were like, please do not even think about touching me. They go from that to like, okay, all right, let's try it. You know what I mean? It's like it seems to remove the dread and put women back into just a more receptive place. And I think when women's libido, when that pilot light has really gone out altogether, then, this heaviness hangs between couples at bedtime, and it can be really awkward and really, I mean, I spoke to one person at length who just told me that it was this silent conversation that we're having with each other every single night, which was silently, she was saying, I know you want to have sex with me. Please do not touch me. And he was saying, I just don't understand why you don't want to have sex with me, and it hung between them and it was really making them unhappy. And when she went on testosterone, it just got them past that and they were able to have a sex life again.
Yeah.
So anyway,
And that, I mean, if you think about what interferes with intimate relationships or long-term committed relationships, money, children, mental health problems, and sex. Like those are the four things, right? So like
yeah,
I can't help people with their money. I can't help people. I mean, I can help them with their like setting boundaries with their adult kids or whatever, or like, uh, and then it's the relationship stuff. Yes, good luck finding a couples counselor. And like sometimes the couples counselor is needed only to be able to help them have sex together. And if you can help that with testosterone in the appropriate context, absolutely. And also, like, yes, there are risks. If you give someone super therapeutic doses of testosterone, people can have a deeper voice. They can have the sort of irritability you described. They can have hair loss or like hyper arousal. And we don't know the long-term effects, but the risks of low dose testosterone pretty low. I mean, I don't know if I think in your article you touched on the sort of the transgender universe where people are, females are given super therapeutic doses of testosterone. Those patients also should be given a warning about the absence of evidence about long-term effects, but so far we aren't seeing major side effects.
right, right.
Right.
And the main thing for people who are transitioning is that they want the kind of side effects that those high doses of testosterone give them. It's just I'm not sure that all of the women who do not want to transition, but are sometimes taking levels of the hormone that put them at the same level as people who are. I just am not. I had yet to speak to somebody who said. I spoke to many women who lost their hair. None of them said I was really warned about it.
Yep.
It's kind of wild.
So Susan, in closing, I'd love to hear a couple things. Like what advice do you have based on your reporting of women who were navigating the kind of medical and wellness spaces trying to understand testosterone? What advice do you have? Because yes, I'm a doctor, and you are a report. You've done a lot of research on this, and what would you recommend to people who are like curious, who are testosterone curious, and then what what are you going to write about next? That's my next question. So tell me what your thoughts are.
I guess I do think, stay away from the pellets. Those they promise a lot, but if it doesn't agree with you, it can be a very long 3 months or 4 months while you ride it out. So that's the first thing. Obviously, we're in agreement that probably the safest, I mean, we do know the safest way to go is to start with a standard dose. If you feel like your doctor is going to make you uncomfortable or you don't want to risk being made to feel uncomfortable or shamed by it, um, I do think that there's this service that I'm a big believer in called MIDI Health. Are you familiar with
Yeah,
them?
yeah,
And what I like about them is that they're not. Um, pushing hormones. They don't really sell hormones, but they are very well trained in menopausal care. I think they do maybe sell a compounded testosterone. So I guess you could factor that in. But I don't think this is not a huge, that's not like a huge profit margin for them. All the doctors there are familiar with testosterone. They're talking to their patients about it. They will make sure that you get your blood levels checked first. They will monitor your blood levels to make sure you're not going into, because I think the hurdle for women can be just not wanting to talk about sex, with their doctors at all. And who can blame them? I think that doctors, they may have a look of dread when that subject comes up. It's probably not because they actually are squeamish. It's just who can talk about a couple's sex life in the 10 minutes that, their managed care, overlords are letting them have. So I feel like it's one way that you can at least go into the appointment knowing that they're not going to think, that it's not going to surprise anyone in that practice. So anyway, that's one thing that I think lowers the psychological barrier to entry.
I think also, if I can add something, is we doctors are often we're a prideful bunch and we're a risk averse bunch and like rule following bunch. And so I think a lot of us feel bad that we don't know about testosterone, or we feel ashamed that we don't have the up-to-date evidence on estrogen and progesterone. A lot of us I had to learn this myself. Rachel Rubin has been like my prime tutor. She's a dear friend of mine. I've been prescribing HRT for a long time, but I had to like, it was like pushing a boulder up a mountain to try to get people to understand that I wasn't trying to like harm them. And I wasn't like pushing it. I was just saying, let's have a conversation. My point is that if you can go into your doctor with your desire to talk about testosterone and say, look, I understand you guys don't get this kind of education. You may not know all this stuff. I don't blame you. Like, where could I go to get more information? In other words, like, doctors like it when you've acknowledged that it's not it's not their fault. Like
Yes.
we're like a sensitive bunch. So I'm not speaking for all doctors. I'm just speaking for myself. When someone comes in and they're like, "Look, I know you're," does that make sense? Like you acknowledge the fact that we haven't been trained on this,
Yes.
we don't have time, and like acknowledge, like, "Hey, I know that I'm trying to cover heart disease in this visit, diabetes. I want to tell you about my new family history. Oh, I've got toe fungus and I'm balding and my low libido." Acknowledge that's a big order and then say, like, can we make another appointment to talk about sexual health? And just the system is so broken. It's helpful when the patient acknowledges the limitations on the doctors, because then it empowers us to help you. I don't know if that's helpful. Maybe that's
Yeah.
victim blaming.
I do get in trouble. As a patient, I'd be like, lady, I don't have time to come back and talk about my sexual health. It's a miracle that I got here in the first place, which is why I do feel like either finding a doctor who has been certified by the Menopause Society, those women and men and everybody, seems to be probably better informed in general about it. And as I said, I do think, and again, just to repeat that, you want to look for a doctor who's been sort of certified by the Menopause Society. You can ask them if they are. But also, I do think MIDI, I do think their care is good and they're very well trained in these issues. But I also think if you are going to go to your doctor and you can say to them, listen, I want you to know I've done my homework. Here are the reputable sources I've gone to. And your doctor will know if it, can help you decide whether the doctor doesn't have thoughts about whether it's a reputable source or not. So you have to trust your doctor that when your doctor says that's not a reputable source, that your doctor really only is saying that in your best interest, not to gatekeep. But go in and say, this is my sourcing. And just so you know, I do know that the studies have only gone out like maybe 2 years, really good research, 6 years, reassuring data, but not perfect data. And I'm willing to, take those odds. The safety profile looks pretty good. If you sound informed, you tell me if I'm
Yes.
wrong. But I think that doctors,
Yes.
if they trust this thing and a patient is like, I've done some homework, and sounds like they've really done a deep dive in authoritative places, maybe you feel more comfortable moving forward.
Yeah, I think that's a really excellent point. I think it's a great point. So, Susan, what's your next project? What's your next? Are you doing more on women's health? Are you doing more on hormonal health? Are you going to just what's your?
I
I'm so
always,
curious.
well, I actually don't love to talk about my work until it comes to pass, because if it falls apart or you don't want somebody else in the, thinking like, oh, that's a great idea, I think I'll do it too.
Sure.
I will always interested in writing about women, and I tend to write about psychology and women's health. And actually, if people have story ideas for me, Susan.Dominus at nytimes.com. I mean, I have people come to me saying that they think there's a lot to be said about osteoporosis and the difficulty in getting accurate diagnoses and treatment. We can talk about that some other time. I'm curious to hear your thoughts.
Oh, I'd love to talk to you about that. I'd love to talk to you about like the sort of pharma versus like, you know, my older patients who really just need to work on balance and coordination. Like you can't break your hip if you don't fall in the first place. Take away those
Yeah,
drugs. So like, I mean, there's so many examples. This is why I write my newsletter. This is why I'm writing my book, where we've kind of parsed medical problems into like drugs or like the wellness industry telling you
yeah.
a bunch of like two things can be true at once. Like maybe you need a little Fosamax, but maybe you also just need to get rid of those throw rugs.
Yeah, and it's also, by the way, amazing what they're learning about how much weight working with weights can really help with that. That whenever there's something that is, I mean, I guess in general, like I do find it fascinating. I have tried to write about this, and maybe you can help me. Like we're all under the impression that Alzheimer's is a ticking time bomb that's coming for all of us. There are actual things people can do to lower the likelihood that they will have Alzheimer's. And of course, like weight loss is always like, a challenge for people, at least in the age pre GLP-1s, but exercise, socializing, eating right, like there are real things people can do to minimize their risk. Not everybody. Some people are just genetically super high risk. But in general, like it has been done elsewhere. And I do think that preventive care is so undervalued. And as you say, it's like,
Amen.
yeah, it's either
I mean,
like over medication or like wellness industry
well,
hoo-ha. So yeah.
if you think about, I mean, dementia is another perfect example of where, you want to think preventatively with patients about their brains, right, and their cognitive health. And there are evidence-based ways to help prevent dementia that aren't bulletproof, but they're evidence-based. They're shown to, like, as you said, prioritizing sleep, exercising, antioxidant diet, keeping your brain active. So, and it's much easier, with all respect to people who worry about dementia, understandably, it's much easier to ruminate and spiral about the fear of dementia than it is to like say, okay, I'm going to make an action plan, especially when you don't have a doctor who's sitting there saying, here are the 5 things you can do in a realistic, sustainable way. I'm not saying go run a marathon and, learn German and to how to play the flute when you're 90. I'm just saying, let's talk about evidence-based ways, realistic, sustainable ways that you can actually improve your cognitive health. Quit drinking without any moral prize for that at all. It's just that is a very, very high yield thing to do if you want to protect your brain. But that's very hard to do. I mean, especially
I
right now.
know. I know, especially right now. But I do think that that's the big picture is just um is is preventive care and taking it seriously and not I do think people reach for pills, that's my feeling sometimes with the
Yeah.
testosterone is just that and I also say this with no judgment, and I myself am sort of trying to figure out where I personally feel about all of it, which is just like, well, why not? People want to live their lives in a healthy way, and so then they're like, I can take this pill for my weight, and then I can take this pill for the this drug for the energy and the sex life, and then if my hair falls out, then I'll just take this other ointment and I'll put it on my hair, and like at a certain point, you're just there's so much counterbalancing going on that I sympathize with the impulse, and I also sympathize with the people who are like, I don't put anything in my body. It's very hard to know where to fall. But anyway, I guess I didn't just say very much
No,
there.
no,
But
no.
these are
It's super interesting hearing it from your perspective, which is so important because you're deep diving on these subjects and you have your finger on the pulse of what people are experiencing in their everyday lives. I have my patients, I talk to my newsletter subscribers, and they tell me what the Wild West is like out there. I'm a person too. Like I am, I sit in a waiting room for 30 minutes for my doctor. I sit on that little deli paper, right, with cold and wondering what I'm going to find out with my own doctor. Like I'm a person too. It's very vulnerable being a patient, especially in this era of information, misinformation, and sometimes too much information. Um, so yeah,
yeah. I
So
mean, we're still figuring out GLP-1s. Like, there's so much good that's coming of it. It's astonishing. It's so inspiring. But I think that they're also, I mean, I think Stephanie Fabian of the Menopause Society told me that they're also finding that women on GLP-1s do experience a decrease in libido, right? So then do you go on the testosterone, even though, it's just, I don't know. There's a
it's
lot of
super
off trend.
fascinating. I want to put a plug in. This is totally unscripted for my friend, my oldest friend, Abby Greensfelder, is producing a movie. It's called The Pink Pill. It's about women's sexual drive. It comes out this month. Anyway, it's going to be in theaters, and it's very cool. So,
I
and
saw the
Rachel Rubin,
trailer.
I introduced Rachel and Abby, who produced the movie, and Rachel's like a star of the movie. It's so cool. I mean, it's about time that women's voices are heard, that women's sexual health is valued, and that the subjective experience of sexual health and even just not having hot flashes and night sweats is discussed. And so I'm glad that you were able to join me, Susan, and share your experience and your wisdom as we try to catch
Such a
up
good news.
from decades of not enough information that's rooted in fact. So thank you very much for your reporting and your work.
It's so my pleasure, and anything that can help women in midlife feel the way they want to feel, I'm so happy to help move that conversation forward. And
That's
really a
awesome.
pleasure to meet you. Thank
Likewise,
you so
Susan, and thanks
much.
for wearing the same color. It was just a special treat to be
I'm
matched
so
with
into
twins.
it. Yeah, we're jogging on fall. All right, take
Okay.
care.
Okay,
Bye.
bye, Susan. Thanks for everybody joining. Bye.
Thank you.